Thank you. It is with great pleasure that I talk to you about the last 5 years of my life. I am a neuro nerd, that's for sure. That's what I call myself. That's what a lot of my students call me, a neuro nerd. And as Dr. Long did say, I am certified in neuro. Have been. We were just talking about it. I've recertified 3 times, so that's 15 years. A long time. When I transferred from Covenant Medical Center to Covenant School of Nursing, I volunteered to work with Sylvia Bach, and some of you have been around long enough to remember Sylvia Bach. She was a professor at Covenant School of Nursing already, and she had already begun working with students who were struggling through nursing school. She donated her time, her free time, which of course there wasn't much of, to advising and tutoring students there at the school. Well, the problem is that because she donated her time was limited, and there wasn't a good day or time to meet the needs of all of the students that were there. So consequently, this generated a few upset students and faculty alike. There were some limitations put on the amount of tutoring that she could do and where and that sort of thing. And that's what born the development of the Student Retention Committee at Covenant. So that's how we got started. So the significance of our little committee here is that in accordance with the Covenant Health System's mission and values under justice, it states that we advocate for systems and structures that are attuned to the needs of the vulnerable and disadvantaged, and that promote a sense of community among all persons. Well, that's our students. The School of Nursing's philosophy and program outcomes state that the education we provide will facilitate the students' development of cognitive, psychomotor, and affective abilities needed to function as a nurse generalist, this should sound familiar to all of you, who's capable of critical thinking, independent judgment, and self-direction. So in view of those statements, we felt that it was incumbent upon us to create a formal and structured program that will emulate these values to our students who are struggling. To define student retention, we refer only to the students who are struggling with one or more nursing program subjects and who show improvement after one or more interventions by the Student Retention Committee. So what I mean to tell you is that we only talk about those students in student retention who have had an intervention from one of us in the Student Retention Committee. The Student Retention Committee, it's a committee formed with members from each nursing level at Covenant School of Nursing, and they serve as a liaison to track, to assist, to counsel, advise students who are struggling at Covenant School of Nursing. And the admissions committee at Covenant School of Nursing generally accepts the top 65 applicants, and usually that is the highest scoring group. We do, however, also appoint 35 or up to 35 alternates. For one reason or another, usually at least half of those alternates are actually admitted. So the retention committee's target population are those students that score on the TEAS, which is the test of essential academic skills. The TEAS test, that's what we use as the nursing entrance exam. Our target population are those students who score 85 or less in reading, 70 or less in math, and those students who have scored 77 or less on 2 consecutive exams. That is our target population. That's who we're looking at. So these students will be identified. They will be strongly encouraged to meet with their level liaison member to discuss their situation. Okay? The committee's goal is to implement teaching and learning strategies to assist these struggling students, achieve academic persistence, keep them in school, and make them successful. So those of you who work for Covenant, you will recognize the SBAR format, and that's how we presented this to the faculty, and you'll see later in my grant. Students who experience academic difficulties are actually slipping through the cracks, and they're not being identified in time to help them. So as a result, they're failing at least one semester of school. Now, those of you who are at Covenant know that you only get to fail twice and you're out. Okay? This increases the overall attrition rates, damages the student's self-worth, and it also puts them at risk for failing the NCLEX on the first try. And that is our goal, is to get them to pass the NCLEX on the first try. So the background. These students experience difficulties usually due to poor reading. Okay? They also have poor comprehension skills, and a lot of them have poor critical thinking. Some of them may have learning disabilities that are yet to be diagnosed. The really difficult ones are ones who have English as a second language. Now, this affects a lot of their schooling, from anywhere from reading to comprehension to understanding, and definitely critical thinking. So these circumstances often put these students at high risk. Okay? Right now, there's currently, or at this point, there was currently no formal system to track these students and to intervene at a good time to assist these students and keep them from failing. I just said patients, did you hear that? My students are my patients, and I tell them that a good deal. So the at-risk students need us to intervene from the beginning of the admission process, okay, through the entire curriculum if it's warranted, if they're doing poorly through all semesters. They should always avoid being labeled, because labels can be a problem. We only will share information on these students on a need-to-know basis, so everything is used. We use discretion and confidentiality on these students. So our recommendations. This is kind of a lofty goal, but our recommendation is to create a plan that would facilitate student success, decrease overall attrition rates, and increase the NCLEX pass rates on the first try. Part of the reason, too, is because attrition rates adversely affect or impact our NLNAC accreditation. So this is difficult. You're going to say, oh yeah, well, these are our high hopes. The first thing we'd like to do is utilize a student retention specialist. And what we'd like to do is work in combination with a student retention specialist and the level student liaison to help create, assess, implement, and evaluate a plan for the students. We'd like to intervene very early. The student retention specialist will make the appropriate recommendations also to community services if they need that. And we'll keep in very close communication with the level coordinators as well as the liaison. The committee further recommends that the student retention specialist, level coordinators, and appropriate persons meet at the conclusion of each of the semesters to discuss their progression into the next semesters and what they're going to need in special accommodations into the next semester. Also to have the grant committee actively seek grants to help pay for this program and to pay for a full-time student retention specialist. Well, those of you who work there know that we have really no grant committee at Covenant School of Nursing. So because, as Dr. Joanne said, I was finishing my master's program here, one of the classes required a grant proposal. I took this on as my project. So I'll talk about my grant a little bit. I picked Covenant Cares, and the Covenant Foundation, because it's a wonderful way to provide supplemental funds to those of us already at Covenant. Okay. The Covenant employees get to contribute to this fund, so they pick projects that they think are important or of value to them. The Covenant Foundation requires gathering of background information, providing a lot of feedback to them. They also like you to have documentation for expenditures that are funded. And all of that goes in with the grant. The Covenant Cares Foundation Board independently reviews each one of these grant proposals, and they approve only those proposals that further the strategic plan of Covenant and Covenant Health Systems, and also those that align with the pillars of organizational excellence there at Covenant. Dr. Addison Gradell has agreed to perform neurodiagnostic testing on our students identified as possibly having learning disabilities. Previous testing by Dr. Gradell has proved very helpful in those students that need test-taking help, that need specialized testing rooms, or that needed extended time for exams. A student retention specialist has been approved according to the bylaws at Covenant School of Nursing. However, no funding for a student retention specialist was budgeted. A computerized spreadsheet also would be helpful in tracking student scores. So I put together these needs for neurodiagnostic testing for a student retention specialist, for a computer program, formulated this budget, and as you can see it's for $11,210, and sent it to the Covenant Cares Foundation. Okay. So the strengths of this, the money from this proposed grant, with this money students will be identified and tracked, and hopefully we can intervene very early. We will track them through the whole 4 semesters and on to completion of the NCLEX exam. The strength of the project is the ability to view their learning styles, their difficulties, their learning difficulties with the ATI and the TEAS tests. We can identify possible at-risks during even as early as the application process here. We can identify applicants with learning disabilities early on to make accommodations, necessary accommodations for them. We can do that early on. We can make referrals to the student retention specialist very early as well if we see that they're going to enter at risk. Okay. The student retention specialist can be sought out at any point. And also, we have now the availability of student tutors. And those things can be sought out at any point. Most significantly with this grant, we'll be able to refer previously unidentified students with learning disabilities for neuropsychological testing. And the reason that is so significant is because most insurance policies do not pay for these specialized tests. And it is a significant price. The cost is significant for them. All right, the weaknesses. The weakness of the project centers around the time with the student retention specialist. Again, because the student retention specialist is probably going to be a full-time faculty member at Covenant School of Nursing, the problem is going to be with scheduling time with the student retention specialist, scheduling time for tutoring. Any time that the students need to take off for neurodiagnostic testing will come out of their schooling time because they go to school pretty much 5 days a week. Okay. So it will require an absence. I requested in my grant enough money for neuropsychological testing for 10 students, and I researched that over 4 semesters to see how many students actually had that. So I asked for enough money to test 10 students. And according to my statistics, that would last 2 years. However, that doesn't always translate to every semester, so I had no way of really knowing whether or not that amount of money would last 2 years. So the outcome. The grant was partially funded, only for $3,200. So part of the grant was used for study guides. Now, they tell you what you're going to use the grant for. So I was able to use some of the grant for study guides. However, new guidelines, as I said, were developed for tutors, and we have a special agreement with students from each semester that graduated from highest in their class to do tutoring. And that's wonderful. So, consequently, I did not need the money that was funded from the grant to pay tutors. Okay? So, of course, I wasn't able to use that money because it's only used for what they specify it for. Okay? No grant money, however, was approved for neuropsychological testing, and that was a real letdown. I was very sorry for that. However, special arrangements were implemented at very little cost to Covenant School of Nursing to accommodate those special testers that were already tested, had already had evidence of needing special testing there at Covenant. Also, another problem was the resignation of our potential student retention specialist, forced a reorganization of our committee, a new committee chairman, and all new liaisons. So to date, no student retention specialist has been funded or staffed. Implementation. So over the last 5 years, which I've been living those 5 years, the aforementioned committee goals and definition were formulated. Handouts have been formulated and revised on things like learning styles, reading advice, study strategies, test-taking strategies, introduction to nursing exams, because it's a whole new animal. As well as posters and handouts introducing the Student Retention Committee. Lectures were formulated for introduction to nursing exams, how to take notes, the difference in learning skills that each one of our students have, listening skills, and again, some specific examples on how to take a nursing exam. I did a lot of research on the Learning and Study Strategies Inventory, or the LASSI. It is a specialized test that tests specifically, diagnostically and prescriptively non-academic areas like anxiety, motivation, attitude, things that the TEAS test doesn't. These are non-academic, non-scholastic things that really impact how well a student does in nursing school. Motivation is one of those biggies. Okay. Funding has been secured just very recently to order the test, and also for the self-guided modules. So the students can go in on their own time on any computer and complete these self-guided modules that are designed to strengthen their learning and hopefully to make them more effective in nursing school. Since there was no grant funding for grade tracking, we advertised for an intern, and most of you know that that's free help. We asked for an intern to help with statistics, with spreadsheets, with data collection, tracking, and trending. And we were so lucky to recruit a master's student, an intern here in data analysis at LCU. And he's marvelous. He needed this, this for his thesis project, so this was mutually beneficial to both of us. Okay? And he's been so easy to work with. His spreadsheet does wonderful things like flag students entering school at risk. It flags special needs testing students, non-traditional students, those with cultural or ethnic diversities, all kinds of things. In fact, it is so smart, I've yet to be able to figure out how many wonderful things it will do. We are so looking forward to getting it in place. place and up and running. So it will have very, very capabilities and uses. So now that you know what we have done over the last 5 years, let's look at student satisfaction. Okay? This might be a little tough for you to read, but I'm going to call your attention to the student assistant. Now, the first thing I want to call your attention to is this is the last and latest semester right here, May of 2012. So these students just got out of school. They just got out of school. These are also only seniors, which typically use student retention services less than any of the others. The most students that we use that use our services are the freshmen. The second most are the sophomores. By juniors and seniors, they've pretty much gotten the hang of it and they don't use our services nearly as much. So I will call your attention to the fact here that 75% of these students said that they didn't use our services at all, which leaves 25%, which is significant, that did use our services. Of that 25%, only 2 of them said that we weren't beneficial to them. Okay? I consider that appropriate. Again, these are seniors, these are exit surveys, and I'll call your attention down here to the Student Retention Committee. This is a lot more data starting in December of 2009. The students that said we were beneficial to them were fairly high at 91.6. Now this is only the students who used our services. 91.6. The next semester, 90. Look at December of 2010. Everyone who used our services thought we were of value. And we start kind of dropping off a bit, whoops, right here, until the December 2011 semester. And I will show you that that is only, and I admit it, 64.7% effective. However, the semester that correlates to that, is here in fall of 2011. And the reason I'm bringing your attention to that is because there were 62 students in that class, and of that 62, the students that passed the NCLEX on the first attempt were 62 for a pass rate of 100%. What can I say? They didn't much like us, but they all passed. Any questions? Any questions at all? That's a lot of information. That's 5 years worth of my life in a very short period. But that's pretty much what's happened with our Student Retention Committee over those 5 years. There's been a lot more things go on and work that we've done that was not quite as beneficial. And of course, because there's never been a Student Retention Committee before, we're sort of flying by the seat of our britches. But I do feel that we're helpful and that we've done some good work with these students. And of course, this is my area of special interest, so I will follow this all the way through. Yes, ma'am.
I do actually have one question.
Sure.
I'm actually in New Mexico, and so things, of course, are going to be a little different between New Mexico and Texas. But we have in the past had a student that had some disabilities and required some accommodations for testing purposes, but then was unable to pass the NCLEX because they weren't allowed to use those tools within the NCLEX. Is that the same here in Texas, and if so, how do you prepare for that?
Actually, we encourage them in nursing school to use the same form and take that form to whoever is doing their diagnostic testing, usually a psychologist, and have that psychologist fill out that form so that not only in nursing school for us, but also for the NCLEX, they will give them the same accommodations. And that's available here. Almost any place you can test in Texas, they'll give you specialized testing accommodations. Okay, you bet. And we have that information. You actually download it from the Board of Nursing website. So go to the Board of Nursing website and look for special accommodations for special testing, and you will see that the form. Now, not just anybody can fill these forms out. There has to the physician or the psychologist that does this has to have special training in learning disabilities. Great question. Anybody else? Yes?
I was wondering if the students are able to reflect and recognize when they're at risk and they're having difficulties, or are they resistant? Do they try to cover it up, or how does that?
All of the above, all of the above. Oftentimes, they won't come and see a student retention specialist until they fail 2 exams. And by the time they fail 2 exams, it's pretty tough to pull it out, especially if one of their scores is below a 60. If they score below a 60 on any exam, it's pretty darn tough to make up those points to be able to pass, because our cutoff for passing is a 75. You have to score 75. So if you score a 60, that means on the tests after that, you have to score high enough to bring that 60 up. It doesn't happen real often. And so we encourage them early on with the lectures that we do, with the handouts, with emails, all of that, to come see us early. When they come see us the first time, we have them fill out a self-evaluation. So our self-evaluation, by the way, is called the Bach self-evaluation. We named it, I'll talk about the algorithm in just a second. The Bach self-evaluation we named after Sylvia Bach, just to give her that honor, because she pretty much formulated it. But the self-evaluation asks questions like, do you have adequate support at home? Do you have financial support? Where do you think your problems lie? Do you study more than other people, less than other people? Do you study in a room full of things going on the TV, that sort of thing? It asks questions to help self-evaluate where they think their problems lie. And to go along with that, we also have what we call a prescription for success. And so we take what they have self-evaluated and look at some ideas to turn that around. Okay? Some people take those things with a grain of salt and don't do any of them, because part of the reason that they're failing to start with is because they're not doing the work that it requires to pass nursing school. So if we work with them in student retention, what that means is we're going to give them more work to do. Well, they didn't do the work to start with, so are they going to do more work? Not likely. So oftentimes we have a little trouble in the student retention committee, and we make them sign a paper that says, yes, I understand this, and yes, I will utilize these things, and I will work towards bringing my grade up. So it's kind of like a contract. I mean, why should I work and spend my free time, which, by the way, not much of, with you who are just not going to do it? Makes sense? So it's kind of a contract.
The ones that have trouble, do they have trouble in high school as well?
Not always, because nursing school is a whole new bear. It's a bear of a different color. A lot of these students will do very well through high school and even college, because the learning is so much different. What we're asking them for in nursing school is critical thinking, and a lot of them don't have much of that. And to apply what they've learned to a real patient situation. And again, a lot of them can't do that. They can regurgitate the information for a test, but they cannot apply it to a real patient. As you well know, our nursing questions are nearly all application. Anybody else?
I had just a little brief response Dr. Long asked me to do. First of all, thank you so much, Leanne. I think all of you that have done some type of project such as this do realize exactly what she said. Tons and tons of work are in the background of this for her to stand up here and briefly present this to you in a few moments. We just know that, so thank you for your hard work and long work on that. I just want to say that you all know that I taught at Covenant a while, and I saw the very same phenomena when I was there, and it sparked an interest in me. These students typically have done A-B work, and they hit nursing school and they start failing exams and they don't know what's happening. And I'm so excited to see your work to help these students. What research shows, and what the literature said, is that we have a school of high stakes testing from public school system through college courses. You're exactly right. They study, they memorize, and they go to the test and they dump. Click and dump mentality. And you have found that with your study. So a few things I thought of just as Leanne was presenting. Most likely this was a welcome activity for your students. They welcome the assistants. They're pulling their hair out. They've typically been an A or B level student and all of a sudden they're failing. What is going on? So I know that they are so thrilled to have this assistance. They are frustrated with their grades and their performance. And the underlying theme is that we want to see students succeed. And you have that in your slides. And also promoting not only the School of Nursing, but the organization's expectation for excellence. It's across the School of Nursing and for the institution. So we want to help promote those students to excellence. Ultimately, I loved your slide on ultimately it promoted pass rate on the NCLEX. And what I think historically has happened is we probably lost some of these students, and now we are able to capture them, keep them in the program, and they have success on the NCLEX. And finally it says, how proud it must make the student and the faculty to see the student overcome and be successful. And I just think that it's a wonderful thing that you've identified in the work that you've done on this. A lot of hard work and time went into this, and how we've been able to capture some of those students that historically we would have lost. And just think how proud they are for overcoming. And they go on and are contributing nursing to the nurses to the nursing profession. A wonderful thing. That's what I would say back to you, Leanne. Wonderful work. Does anyone else have anything you'd like to say? Dr. Joe? Are you sure no one else has anything?
I just wondered, you know, I'm kind of in the evidence-based mindset most of my time now in what we're trying to create here. And I wondered if you, in thinking about this as a possible best practice, especially for schools that don't have designated departments or designated positions, this is an example of when really through a team committee approach, you accomplished your goal. And I wondered if you had thought about looking at financially the savings to the school in terms of slots that are saved. What does that save the organization? Because you know, if a student drops in a semester, then that slot is closed. So you lose financial resources in terms of faculty time that is not properly used. It's a slot that someone else was turned away from. And I wondered if you have thought about looking at doing a financial analysis of what this is doing for your organization.
Wow, that's kind of a deep subject. We are, because Marcus, our intern, has helped us with this new spreadsheet, we'll be able to track and trend so much more data than we were ever able to do before with just our Excel types of things. That may be something that, you know, because we are wholly owned by the hospital, you know, they like to see dollars and cents, so that may be something we decide. I appreciate that. I will definitely give that some thought.
I would just encourage you that when we think about evidence-based practice, it's not just our patients, but it's how we conduct ourselves, whether we're teachers or clinicians or scholars, whatever. And if we can show that it's clinically important, this is clinically important, it's even clinically significant because you're retaining students, looking at the cost also, and then putting that in the literature. Because I feel like there are hundreds, literally hundreds of nursing schools around the world that are probably in the very same situation. They do not have the designated resources for this, and yet a model like this, especially if you compare it with what it might do financially, would really be worth, that would be worth putting out in the literature. I thought I want to encourage you there.
Thank you.
It is kind of important too, from the aspect of the nursing schools for accreditation, and your what do you call it, the 100% graduation rate, where students don't have to repeat semesters and add that cost into the school, just like you're talking about, Julianne. And it also says something about the quality of your school, and you're absolutely right. Schools would be very interested in kind of programming like this because you did it Joanne, you put that there. Leanne, you put that together with virtually no resources. Because I know there's no resources. And so I mean, it's a quality parameter that you're addressing that it's really ultimately very, very important to the school, the quality of the school, and also to your student and your graduate. You showed a lot of success, so great job.
I'll say one more little thing just to agree with this. That it's a great example of how just a small amount of dollars, I mean, you didn't have a whole lot of, but those dollars can be so stretched. And nurses, we're great at that. We're great at taking a little bit and making it go a long way. And again, I would just really encourage you to share this work. You've done some fine work, and I believe it could be very encouraging to others that with just a small amount of resources, look what can be accomplished in terms of retaining and helping students to succeed. Well done. Thank you.